So, look, I have to say, I don't think my last introduction to Dr. Ken Harvey has needed to be updated much since last time, because he's still a serial pest to the pharmaceutical industry. He's still a serial pest to the CAM lobby, and he's still a serial pest to the TGA. But to us, he's better known as a champion of consumer protection and science-based medicine. Ken Harvey, AM, is president of Friends of Science in Medicine. He's an honorary adjunct associate professor in the Institute of Evidence-Based Healthcare at Bond University and a consumer advocate and educator. He has been awarded life membership of both the Australian Skeptics in recognition of his relentless campaigning against shonky medical products and claims, and Choice Australian Consumers Association Award for Service to the Consumer Movement. He was also awarded the ANZ Association, sorry, I've gotten my acronyms wrong here, the Australian New Zealand Association for the Advancement of Science Medal in recognition of his long-standing advocacy for evidence-based medicine and treatment. And this morning he's going to be presenting on the last 10 years of Friends of Science in Medicine, 10 years of pushing science and skepticism. Over to you.
Thanks, Jo. Loretta Marin was the catalyst for Friends of Science in Medicine. TV advertisements for magnetic underlays got her going, then homeopathic remedies, followed by natural cures for cancer. And to investigate these outlandish claims and submit complaints, she needed to consult with experts. These included Professor John Dwyer, medicine and immunology, and Alistair McLennan, obstetrics and gynecology. They were always willing to help. They also had concerns about universities teaching pseudoscience, such as subluxation theory in chiropractic and meridians in Chinese traditional medicine. So Professor Dwyer proposed that Loretta join forces with senior colleagues to form a new organisation. And so Friends of Science in Medicine was born in December 2011. The aim was to emphasise the importance of basing Australian healthcare on established scientific knowledge. Valuing scientific rigour is especially important in an age where unsubstantiated health claims are rampant and scientific consensus is imbalanced by the views of extremists. So our focus is helping consumers and health professionals make more informed choices about medical interventions, medicines, and medical devices. We do this by submitting complaints about unethical practice, analysing policy, making submissions, encouraging regulators to act, and being a credible source of expertise to the media and others. We also encourage tertiary institutions and students of medicines and health sciences to critically appraise therapeutic products and services as part of the courses offered. So, what have we achieved? I took over as president from John Dwyer in 2019. Loretta remains the CEO. The founding members continue their involvement as consultants. Currently, FSM has more than 1,200 leading scientists, clinicians, lawyers, and consumer advocates as supporters. We also work closely with organisations such as Australian Skeptics and Choice, the Australian Consumers Association. 10 years on, it's worth reflecting on what's been achieved and what challenges are ongoing. And to achieve this, I have 4 case studies for you. The first is problems at the food medicine interface. Avamere, a unique and clinically researched. Scientific studies show that this product enhances the efficacy of conventional cancer treatments such as surgery and chemotherapy. And with a regular intake of Avamere, patients can relish a better quality of life and enjoy a better lifestyle. Now, the claims were not in accord with the body of clinical evidence applicable to this product. A recent Australian systematic review of the effectiveness of Avamere as adjunct therapy on the treatment of cancer concluded that its clinical effectiveness has yet to be established. The US Memorial Sloan Keating Cancer Centre notes that the human studies are limited and benefits must be confirmed by large-scale controlled trials. Avmer Australia sold the product to consumers and practitioners via the internet. It costs $220 for a month's supply. The product was claimed to be a food for special medical purposes for cancer patients. Now, Food Standards Australia New Zealand has a standard 2.9.5 food for special medical purposes, which is defined as food formulated for individuals who have specially medically determined nutrient requirements or whose dietary management cannot be completely achieved without the use of the food. They're also intended to be used under medical supervision. Now, we are unaware of any evidence that the first two conditions apply to this product. And in addition, the products are being sold over the internet, which contradicts their use under medical supervision. So the problem again is that medical foods can be self-declared by sponsors without any pre-market assessment by FSANZ or other authorities. Oops, we go on cookie. FSANZ standard 2.95 also has contradictory clauses containing the claims made and use under medical supervision. And the Therapeutic Advertising Code prohibits sponsors of medicines from referring to cancer, mental illness, and other serious forms of disease. But Standard 2.95 provides no such restrictions. So we're left with a significant discrepancy in consumer protection between therapeutic claims made for medicines compared with claims made for food. For medicines, the Therapeutic Good Advertising Code applies, administered by the TGA. For foods, FSANZ standard applies, administered by state and territory food departments. So, how to tell if a product should be regulated as a food or a medicine? Well, the TGA provides a food medicine interface guidance tool, a series of questions. Is the product for oral use by humans? In our case, yes. Has it been declared to be a therapeutic good under Section 7 of the Therapeutic Goods Act? No. Has it been excluded as a therapeutic good under Section 7AA of the Act? No. And is the product goods for which there is a standard in the Food Standards Code? Yes. So the product is not a therapeutic good. It is likely to be a food within state territory food regulation. So on August the 21st, a complaint about the product was submitted to the Food Safety Standards and Regulation Queensland because Avmer was a Queensland company. On the 31st of August, we were told the product had been assessed by Queensland Health. They were of the view that the product was likely to be a therapeutic good, and as such, they referred it to the TGA. The TGA, when we asked for an update, said, the status is a complex technical legal matter, the subject of an ongoing TGA investigation, and we are currently liaising with our partner agencies to decide its status. But some months later, they came to a conclusion that the products were therapeutic goods within the meaning of the Act, should not be regulated as foods, and as the products were not included in the Australian Register of Therapeutic Goods and contained prohibited representations about the treatment of cancer, they contravened many sections of the Act. A letter was sent to the advertising requesting cessation of unlawful advertising, and in response, the website was removed. So in Australia, the site can't be reached, but in New Zealand, the promotion continues unchanged. So, also, no action has been taken about the problems underlying this complaint and others. FSANZ Standard 2.95, which allows sponsors to self-declare a food for special medical purposes without any pre-market assessment and no constraints on promotion. Previous cases have involved medical foods promoted for Alzheimer's disease, Suvenaid, and depression, Neurotholin. Significant delay and consumer detriment has occurred while individual cases are being resolved. And to prevent further cases, an application for food for special medical purposes needs pre-market evaluation by the TGA or FSANZ, not self-assessment by the sponsor. The contradictions within the standard need to be resolved, and the TGA and FSAN needs to harmonise advertising standards across the food and medicine interface. So we've written state and territory ministers for health requesting that food medicine regulatory inconsistencies be placed on the agenda of a future food ministers meeting. Another case, intravenous therapy. Offering IV therapy as a panacea for numerous conditions is a nice money earner, often adopted by integrative medicine clinics. Many claims made that it will boost immunity, that it will slim and eliminate fat, that it will purify the body and detoxify your body, and it will keep you young and is anti-aging. And it will also produce healthy brain function, proper nerve function, and if you want it all, a mere $300 will provide the products. So we put in a complaint to the New South Wales Healthcare Commission in the 11th of February 2020. We said a number of New South Wales businesses are making therapeutic claims for intravenous therapy that lack scientific evidence and exploit consumers. Some offer a mobile service. They'll come to you and administer IV drips at weddings, ducks and hens parties, even poolside after a big night. And they claim to use registered qualified nurses and medical staff. They charge up to $300. They also offer inducements such as buy 10 and save $350. In our opinion, the companies concerned and the medical and nursing staff they employ are in breach of Section 133 of the national law because the claims made are false, misleading and deceptive and encourage the unnecessary use of health services. So we got a response after we checked up 15 months later from a few months later, we got a response from the New South Wales Healthcare Complaints Commission. They had finalised the assessment and they had decided that they hadn't identified any conduct issues or serious risks to public health and safety, but they referred it to APRA, the Australian Health Practitioner Regulation Authority, to manage concerns about advertising. So what? No problems with unnecessary and exploitative treatment by health professionals, no problems with poolside administration of IVs to inebriated customers, no. So then we followed up with APRA 15 months later, not having heard anything. We found, yes, the matter remains open and it's our normal practice to update complainants only when we finalise the matter. So thank you for bringing this matter to APRA's attention. It is ongoing. Meanwhile, DRIP IV Director was awarded the 2021 Alternative Medicine Entrepreneur of the Year. Presumably the profits are ongoing. They're offering gifts of intravenous vitamin drips and the regulators have done nothing. The next case is vaginal lasers for menopausal symptoms. The demand for effective alternatives to hormone treatments for vaginal menopausal symptoms has contributed to the rapid dissemination and uptake of commercially available laser treatments. They're promoted and used in Australia by many clinicians. They claim to be the solution for vaginal atrophy by restoring vaginal mucosa, and the cost of treatment is a mere $3,000. Now, a recent research showed that from the University of New South Wales compared fractional treatment of vaginal lasers to treatment with sham treatment in a large randomized controlled trial. Oops. Over 12 months of follow-up, there was no difference to symptom severity. Sexual activity rates and quality of sex were also not significantly different even after 12 months. And vaginal wall biopsies taken at baseline and then 6 months into the treatment showed no significant improvement. An accompanying editorial in JAMA noticed that the widespread use of this therapy based on highly optimistic short-term uncontrolled trials, followed by mounting reports of adverse events, evoked a sense of déjà vu. It was akin to the rush to market of vaginal mesh products before the completion of rigorous trials. And it raises also the question about the regulation of medical devices. So let's see a video. If we can have that video, please. Video, can we have a video? I can't seem to see it here.
We wanted to really test the approval process for medical devices. If we would build a vaginal mesh that was so dangerous and so ridiculous, would we get it through? So we bought a net of mandarins and we went to the notified bodies and we said, would you approve this? And they didn't see any problem.
So, problems with regulators. So this year, FSM consultant Emeritus Professor Alistair McLennan wrote to the TGA pointing out that at least 3 surgical laser devices had been included as medical devices on the Australian Register of Therapeutic Goods since 2017. And they were widely promoted and used without evidence. He noted that the US FDA had not approved any of these devices, and they'd also warned consumers about serious adverse events of vaginal burns, scarring, and pain during sexual intercourse. In response, the TGA said the TGA planned to recommence a post-marketing review of these devices, which they had postponed because of COVID-19 pressures. And they would also work with other regulators, including Health Canada and the FDA. So one needs to keep the pressures up on the regulators. My last case is a case of student activism. For an exercise in critical appraisal, students were asked to pick a complementary medicine, review the claims made about evidence found in the scientific literature, and make an educational video. This is one example.
Odorless high-strength wild fish oil, a natural source of omega-3. It supports your heart health, based on scientific evidence. So guys, we've searched through Ovid Medline, EBM Reviews Cochrane Central, the Grey Literature, and the Australian and New Zealand Clinical Trials Registry. So what have we found?
During the research of our WAM product, we contacted Swiss about their evidence for their product. They responded that their evidence was only available on the New Zealand and UK website and not on the Australian website. Though, looking back now, evidence has since been removed from all the websites and consumers are unable to view evidence surrounding their product. Nevertheless, the supporting evidence that they previously supplied was susceptible to selection bias due to their positive results being published 10 years or more ago.
A systematic review by Campbell et al. Published in 2013 also found that in people with normal blood pressure, increased EPA and DHA consumption had a non-significant reduction in both systolic and diastolic blood pressure.
Guys, come quickly. Our search strategy's got a big catch in the sea of evidence. This is a Cochrane systematic review, considered to be the highest quality evidence you can get on a topic. It's by Abdel Hamid et al. And it was published in 2018, so it's recent too. This systematic review is looking at EPA and DHA omega-3s, just like the Swiss product uses in their fish oil capsule. It says here that it's the largest systematic assessment of omega-3 fatty acids on cardiovascular health today. Let's see what they have to say. It says here that they found little or no effect of increasing EPA and DHA omega-3s on all-cause mortality or cardiovascular health in those that were taking the fish oil supplements. So after searching the literature, It looks like there's actually evidence that's contrary to Swiss's claims, and the fish oil has no effect on heart health at all. It looks like this one will have to go back. I can't believe that there are products like this Swiss high-strength fish oil that are on the market that have claims that aren't backed by reliable scientific evidence that could totally mislead consumers into buying their products.
Maybe I'll consult a healthcare professional for their advice, as well as searching for the best available evidence for what I can do for my heart health, rather than trusting these complementary medicines.
So, a popular program and amongst students. But let me sum up. The peddling of unproven and sometimes dangerous remedies has existed throughout human history. There's always going to be companies and individuals who put the pursuit of profit before ethical behaviour. There's always going to be advocates for deregulation and regulators captured by industry. To protect consumers, there must be opposing forces. That's the role that Friends of Science and Medicine is proud to play, along with university students, colleagues from the skeptical community, and the consumer movement. Thank you.
Thank you, Ken. That was fantastic and really great to hear some of the incredible work that Friends of Science and Medicine has been doing. We really, we've got one question here from the audience, and then I have a question for you as well. And it's actually a pretty simple one. So, so a question from I think it's Amnon Carmel. And the question is, what is the best way to contact Friends of Science and Medicine to report scam products?
Yes, we have a website which is easily found by searching on Google, Friends of Science and Medicine. And if you, again, we have contact details there. Again, you can also search for me, Dr. Ken Harvey. My email's readily available, ken.harvey@medreach.com.au. We love people sending in concerns. We can send those out to our students and get action.
Fantastic. Ken, look, I guess, one of the questions I wanted to ask you, we keep obviously talking about COVID and the impact that it's had on a lot of the products that are being promoted and weird and wonderful things. In terms of the regulators themselves, you mentioned the challenges that you've had in terms of, I think the focus of the regulators has shifted at the moment because of COVID. Certainly, I've been reading a lot about complaints that are being submitted to APRA, which is the regulatory body for health professionals here in Australia, about doctors actually promoting science and promoting vaccines. But I'm just wondering kind of what your experience is of the regulators at the moment in terms of how COVID is impacting your ability to be able to get action on things outside of COVID, and what you see the way forward for really dealing with the landscape at the moment.
Yeah, thanks. Well, as you said, there's two groups of regulators, those that deal with health professionals, and APRA, the Australian Health Practitioner Regulation Authority, deals with registered health professionals. That's doctors, pharmacists, but also chiropractors and others. They don't deal with people like naturopaths, homeopaths. They are dealt with by state-based health complaints consumers. So again, there's a difference there. APRA, we have found to be very slow. Waiting 2 years to hear about a complaint outcome is not uncommon, even longer. We have had regular discussions with APRA, and again, they have improved some of them. They say they've improved some of their processes dealing with advertising complaints. But essentially dealing with malpractice, unless it's practitioners basically having sex with patients, which they do take seriously, they don't seem to care too much about misleading and deceptive practices. And also, they don't really bring in stringent sanctions and complaints. At the best, they might chastise someone, tell them to take off their advertising, etc. So APRA is a problem. They are saying they're about to do some prospective monitoring of advertisements, and that would be good, but we haven't seen the results of that as yet. So again, APRA is a problem. State health-based complaint commissioners usually work better, but again, they only deal with non-registered health practitioners. When we get to our friendly Therapeutic Goods Administration, the TGA, now again, to be fair, they have taken action on complaints against COVID-19 products. They've got stuck into ivermectin, they've got stuck into people making outlandish complaints, and they have used some of their new powers that they were given a couple of years ago in terms of putting on fines and doing putting other penalties on people. But again, partly because of their focus is on COVID-19, other complaints have languished. We've had complaints over 2 years outstanding for things that they said were high priorities, such as complaints about products saying they worked against obesity, hangover products. Apart from the odd token effort, nothing has happened. And again, we've been very concerned about the TGA. They took over a new complaint system a couple of years ago from the Complaint Resolution Panel with new powers and with new sanctions. But in fact, the number of complaints coming in caused them to be totally behind the ball. Their response was to get a consultant who, in the best traditions of consultants, decided that, well, it wasn't in the public's interest to actually put more resources into the complaint system. No, rather, complaints now would be used simply for intelligence, and they would sort of use this intelligence to decide a few priorities, such as COVID-19. So most complaints going in now receive absolutely no action. A nice little letter saying, it's used for intelligence. Thank you for sending it. So a lot of concerns.
And I suppose that in from that point of view, you know, we always like to give people kind of action guiding statements. I suppose that from that point of view, then as skeptics, we probably then need to be a little bit careful to ensure that complaints that we submit to regulatory bodies are really well targeted and well thought through, so that in fact, you know, given the lack of resources, that, you know, obviously we want them to be better resourced and and so on, but we also don't want to kind of throw at them complaints that are going to take up more time but are unlikely to sort of really gain traction.
Well, I think the key thing is to follow up. I mean, I do believe that one should put in complaints that you think are legitimate. I wouldn't hold off doing that. And again, one of the suggestions that skeptics might do next year is actually track all the complaints that are put in, and I think we should keep on putting in complaints despite the fact that the TGA isn't dealing with them, and then publish reports every 6 months or so about what's been actioned and what hasn't been, and that's hopefully a project for next year.
Yeah, and I suppose having friendly journalists who might be interested in looking at some of that data would also be helpful.
Oh, indeed. And indeed, journalists have been a great help. And indeed, one of the few things that have moved APRA to action has been scandals in the newspapers about cosmetic surgeons and chiropractors cracking the backs of newborns. So journalists, investigative journalists, are crucial to our cause.
Excellent. Ken, thank you so much for giving us that update. You know, we really appreciate all the amazing work that FSM are doing. And I think, you know, of course, I direct everyone to go and contact them if you want to help them in their work.